We're back. Seems like the 100th time this weekend. It's only like number 8, but it's it's a lot. Hey guys, welcome back. I don't know if anybody's been able to be live for all 8 of these sessions this weekend, but we've had fun. And I am so thankful to all of our presenters because it's been amazing. I think I've learned a lot, and so I'm sure you have too. But we are really lucky to cap this off with the famous Dr. Jean Dodds, who is an amazing woman who gives so much of her time for our pets. Dr. Jean Dodds became a veterinarian in 1964 after graduating from the Ontario Veterinary College, and she has spent more than 5 decades as a clinical research veterinarian. She holds 25 patents. She's much smarter than me. She's co-authored 2 books, and I have one of them here, The Canine Nutrigenomics, and I can tell you that I've read it because it's got yellow highlight all through it, and I'm one of those people that cannot read without a highlighter in my hand, sometimes 2 or 3. And she has over 150 research publications. She started Hemopet in 1986, that's out in California. It was the first nonprofit national animal blood bank. And she released NutriScan, which is a food sensitivity and intolerance diagnostic test for dogs, cats, and horses in 2011. And I believe that's a saliva swab?
Correct.
Great. So Jean, thank you so much for agreeing to do this. I know that your time is valuable and you get requests to speak really all over the world. And I'm just really honored that you are taking time out of your day to do this for us.
Well, and your friend, my friend.
And I'm going to ask, are you in Italy? Are you in California? Where are you? You're all over the place.
We're supposed to be in Italy, but we can't go there. So we're in California and we're on lockdown like everybody else.
Do you have family in Italy? Is that why you're in Italy so much?
No. We went there years ago because it was halfway between South Africa and Canada, where our 2 mothers would meet because it was hard for them as they got older. So we would meet in between. And we went to Venice, and when we got there, there were a family of veterinarians that needed some reagents, diagnostic reagents. And so I took them with me. And when we got to Milan, the police came on the plane and asked, is there a Dr. Dodds here? And we thought, oh my God. So the Carabinieri, the Italian police, escorted us off the plane. And we were sure we were in big trouble because I had this antibody serum in my purse. And when I got there, this guy with a red sweater and a cap on, newsboy cap, famous Italian veterinarian, said to me, don't worry about it. That's just bureaucracy. Just give me the stuff. I gave him the antibody to measure von Willebrand factor. They insisted that we stay in a hotel that they arranged for us, and they insisted on paying for it. So we became very close friends with his family, Stefanon. They're veterinarians, 3 generations of veterinarians north of Venice, in Concordia, Sagittarius. So that's how we started.
Wow. So small world, got a little smaller, although now it's gotten, impossible to travel anywhere. So hopefully that won't be forever and you'll be able to go back. Okay. All right. So you are pretty much known, I mean, you're known for so many things. You definitely have, strong opinions on vaccines, strong opinions on diet for dogs and cats, as do I, and that's one of the reasons why we're in that same sphere. But I think the first thing that I ever heard about Dr. Jean Dodds was if you have a thyroid problem, you have to use Dr. Jean Dodds, use her lab, and get consultations from her because she's sort of the guru. And we all have our special people that we go to for certain things. And thyroid disease in our pets, it's really interesting. When I went to vet school, so I graduated in 1984. And when I went to vet school, they made it sound like, oh, well, you run that T4 test, and if it's low, you treat them, and if it's not, you don't, and it's that simple. And then through the years, I would go to veterinary conferences and they would be talking about all these other tests that we should be running. And is it a T3 problem or a T4 problem? Is it a free T3, free T4? Is it a TSH problem? And how do you diagnose it? And all of a sudden, it seemed like what I was told was so simple became so complicated. So is it simple or is it complicated?
Very complicated, as it is in people and all mammals, actually, because it's a major metabolic regulatory hormone controlled by the pituitary gland.
Okay, so is, well, now you just took me down a whole different path. So the thyroid is controlled by the pituitary gland. Does that mean that these dogs that have thyroid problems also have pituitary problems? Is their entire endocrine system out of balance?
That's a complicated question. Some of them have growth hormone deficiency, but the problem is, as you know, Judy, we can't measure what the pituitary output is directly very well. And there's a pituitary hypothalamic thyroid axis. And so then you get the other endocrine organs coming in, especially the adrenal gland, into the hypothalamus. And that's why many animals that have Cushing's disease, for example, as a common hyperactive adrenal gland syndrome, have a low total T4, and they get treated for thyroid when it may not be appropriate at all. But these things do go together. So we have what we call a polyglandular autoimmune syndrome, where more than one gland is affected at the same time. The classical one being Evans syndrome, which is anemia with a low platelet count. Low red cells, low platelet count. It's called Evans syndrome in people and animals, and pets get it as well. And guess what? They often have underlying thyroid dysfunction as the reason for it attacking their blood products, blood cell production.
Interesting. So, and I've never even heard of that. So, see, I'm learning right along with everyone else. Boy, and that's going to take me, I got two things that come off of that. So what's the connection between SARDS, which is the sudden acute retinal degeneration syndrome, which is an autoimmune problem? There seems to be a connection between that and thyroid disorders.
There's a lot of connections between any part of the body and a thyroid disorder. And not only SARS, you have dry eye. Remember, the Cocker Spaniel was the one that was first recognized by Rene Caswan at University of Georgia years ago, showing that Cocker Spaniels with dry eye often have underlying heritable autoimmune thyroid disease, which they do. And the reason I got interested in thyroid function, Judy, was because I was a hematologist and I was studying blood things and immune things. I thought, wait a minute, this is ridiculous. Why are we studying just one part of the body when we have a metabolic regulatory system that controls everything else? So that's how I got interested in holism with a W, right? And then we have to do one medicine, one health today, looking at how mammals are all the same as are many wild animals, et cetera. Why we're the same, why we're different. It's fascinating.
It is. And so and it's interesting because I've never heard the thyroid connection with the dry eye connection, except that they're both autoimmune diseases that are affecting glands in the body. So duh, makes perfect sense. You know,
it's about nearly 20 years ago now when those studies were first done. And in golden retrievers with significant problems with the eyes, the experts in Long Island, for example, I told them, you're looking at the wrong thing. You've got to look at their thyroid, because they're golden, right? You've got to look at their thyroid function in terms of predicting whether they're going to develop eye problems. Interesting, right?
It is interesting. So will the thyroid levels bottom out before the eye problems happen, or the secondary, whatever the other problems are? Or is it something, if you're monitoring thyroid levels, like in our clinic, we recommend lab work every 3 months, particularly for dogs once they're past middle age, or if they're on any medications or have any chronic problems. So that's like 99% of the population. And so when we're doing this lab work every 3 months, there's always at least a T4 on there. And so a lot of these animals, we'll see they start with a 2.1, and then the next time they're a 1.9, and the next time they're a 1.6. And then finally they drop down below what's considered the normal level. So if we have people who are doing lab work repetitively, and they're seeing that start to slide downhill, is that something that they can be proactive about?
100%. The problem is that you're looking at a T4 assay, which is basically useless by itself. And unfortunately, and no, that's because there are different ways to run it. And there's an excellent review article from Kathy Scott Moncrief in her group right now that just came out actually a week ago, looking at, say, the commercial catalyst test, T4, the Immulite T4 that the big laboratories do, and then another different kind of microgenics. Now, many of the commercial reference laboratories use microgenics, which is a human T4 antibody test. And we already know that in the dog, for T4 specifically, you need a canine specific reagent to get an accurate number. So the one that everybody has a contract with at big companies is a human antibody test. So right away, you know there's a problem there. The second thing, the other one, which is a chemiluminescent. First of all, we want to get away from radioisotopes, right? We don't want to use radioisotopes for diagnostics these days because they pollute the earth. We want to use chemiluminescence in other ways. So the one that they competes with that is chemiluminescence, okay? And then we have this dry test that veterinarians use in their office, you know, the catalyst test. Now, the conclusion of Dr. Kathy's paper, very complicated paper with all kinds of statistics and whatever, was that if you use one test for just a T4, you have to use the same system to monitor that patient thereafter. So in other words, when you get a referral from a patient that has a T4 done somewhere else by a different method, they're not equivalent.
Interesting.
Particularly at the low end of the scale, but it really doesn't matter. If it's less than 0.5, it doesn't matter if it's 0.1, it's too low. The problem is with the high end of the scale, especially when you're looking for hyperthyroidism in cats, or you're looking for monitoring the dose of therapy on an animal on thyroxine therapy. It reads too low. So what does that mean? We keep increasing the dose until the pet goes into thyrotoxicosis and the body excretes it faster. So instead of getting higher or too high, it gets lower, lower, lower.
Right.
So veterinarians are totally confused at this point.
They are. And it's funny, we, in our clinics, we've always used Antec labs. And when we would send in thyroid recheck levels, they have a post T4 test that you have to ask for. So it must be a different sort of testing to actually.
Different range.
Okay.
Different result range. Okay, so that's one of the problems. I mean, we do our own laboratory. We have our own patented technology, but that's okay. And we're the only laboratory that uses breed and age specific ranges, because you can't expect the metabolism of a Chihuahua to be the same as that of a Newfoundland.
Right.
The Newfoundland would be in big trouble if he or she had the energy of a Chihuahua, right? And also the other thing, Judy, is they don't live as long. And so we have aging related reduction in metabolism as a normal thing in a giant breed when they're 8 or 9 or 10 years of age versus the Yorkie that lives to be 14.
Right.
You know, so the range you expect in a 10-year-old Yorkie, even with the size issue, is not the same as a 10-year-old St. Bernard. I mean, if they live that long, God forbid. I mean, please God, right?
Right.
So, before I forget, one other thing you mentioned is you don't see typical clinical signs that the veterinarian's waiting for of thyroid dysfunction until at least 70% of the gland has been damaged or inactivated. Right. So the problem is we can't wait for that, because then as you said, the bottom falls out of everything. Right. And then on. What we have to do is we have to improve our diagnostics to detect the early stage of the diseases in the beginning, because it doesn't happen overnight. We tell our clients, right, you don't wake up tomorrow and become hypothyroid. You got there over a year to a year and a half. So we have to be able to diagnose the early stage. And one of the things you said, serially monitoring will help. If you do a free T4 as well, please.
Okay. So autoimmune thyroiditis. First of all, does the thyroid just decrease function with age, or when we see these thyroids that are tanking, is it always autoimmune disease?
90% of the time in purebred dogs or hybrid breeds of purebred dogs, it's going to be autoimmune thyroiditis. And that's progressive over time, a year to a year and a half or so. And you aggravate it by eating glutens. Now that's new stuff. Relatively new stuff. So all of these pet foods, you know, we talk about the grain-free, and let's not even go there, but you know what I mean. If you're feeding grains like wheat, barley, rye, oats, unless they're labeled, spelt, kamut, couscous, etc., farro, if you're feeding those glutens, that's stimulating autoimmune thyroiditis, because the common protein in the glutens is gliadin, Gliadin, and it has the same molecular map as thyroxine. It's a molecular mimicry protein. And
Wow.
because it looks like thyroxine, it gets the thyroxine screwed up. So the first thing you do with a diagnosis of autoimmune, I just did one for a client, a veterinarian in Australia who has a beautiful Sheltie breeder who has an affected mother with 2 offspring. Now she doesn't know what to do. Well, the veterinarian didn't understand it. So just before I came on here, I answered her and I told her that they have to stop eating any glutens. That's real, many of us aren't anyway anymore,
Right.
but that's important. I mean,
So that's pretty funny, because my next question was, are there any foods that we should avoid if we have animals that are tending toward a thyroid problem? And are there specific foods that should be added to the diet for pets that are dealing with this?
You don't want phytoestrogens. So that would be soy, right? Maybe peas, right? Peas, lentils. Right. Millet is a goitrogen. Cauliflower and broccoli are goitrogens unless you cook them a little bit. So cruciferous vegetables, the raw cruciferous vegetables are goitrogens unless you steam them lightly.
So if they're cooked, then they're okay. Okay.
You don't mash them until whatever, what can we do? Basically healthy food, whole foods, a variety, dense, right? Dense foods, real foods, not junk foods. They're good for the thyroid. And then of course you have to avoid food intolerances, right?
Right. Yeah. Well, this whole weekend has been all about the microbiome in the gut, and it didn't start out that way. And we would be talking about something totally different, and it always landed there at the end. It's just, the gut is so important.
Gave a webinar for CIVT on that subject this week. And I said, quite frankly, there's so much about it right now, it makes me vomit. And I meant that, as a joke, but because I'm writing a major review right now on that, you can't get around it. Every day there's another paper. Yeah. I mean, it's amazing. It's amazing. So I think we have to pay really careful attention to the diet and make sure it's wholesome, and then make sure the animal doesn't have any food intolerance as well. Yep. And those.
And that's where the NutriScan test comes in.
Correct. It's amazing. I mean, we have people tell us, oh, but my dog reacted to rabbit and the dog's never had rabbit. So I said, do you have any rabbits around your home or in the dog park or whatever? Oh, we have a mother rabbit and the babies underneath our porch, and she runs in the backyard. And then the client says, oh my God, my dog is eating rabbit poop.
And that's how you find out.
Yeah. Well, I mean, it was a rabbit. She didn't think about that. So you have to become a detective, right?
You do. And it's funny because we had a nest of flying squirrels a few years ago that we had a very windy day, kind of like we're having today. And all the babies got blown out of the nest. I didn't even know we had flying squirrels. Oh. And so the first, I go outside, and in a flower pot, I see this little baby squirrel. And I'm like, what are you doing in there? He's only a couple days old. So I picked him up and put him in a shoebox. And then a few minutes later, I'm walking around the yard and I find another one piled off somewhere else, and I pick it up. I'm like, well, I wonder if there's more of these. And as I'm walking across the yard, I see my old Cocker Spaniel go, oh, and there's a tail. And I couldn't get it. It went at one bite. And I was like, oh my God, like, what are you going to do? But we did save 3 of the baby squirrels, and they went to the rescue. And they said that flying squirrels are actually very unusual in our area. So they were kind of excited to have flying squirrels. I said, well, don't bring them back here because I don't trust my animals.
I had an English setter when I was away teaching on Prince Edward Island. The dog sitter was watching, and she called me out of a meeting and said, I don't know what to do, but Tippy ate an entire rabbit, a whole baby rabbit, got it out of the ground, and it swallowed the whole thing. I said, don't worry about it. She'll be fine. Poor rabbit.
Raw protein. Yeah. Poor little animals, but raw protein. Okay. So back to where we were. So what is the best? I know on the Hemopet website, which is hemopet.org, that's where people can go to see. So people can go to their veterinarian and have the blood drawn and have it sent to your lab if they don't want it going to the labs where they're using human serum, antigens, whatever, in their testing instead of canine. It seems like if you're testing a dog, you should be testing for canine. Do you have different reagents for feline as well?
Yes.
Yeah, so that makes perfect sense. So if someone wanted to have their veterinarian draw the blood and send it to Hemopet, I've been on your website. I've printed out your forms because I've sent stuff there. There's like 10 different choices. How do you decide which one you need?
Well, we have to offer a variety of things. If the animal is young and healthy and of a breed at potential risk for thyroiditis, we do what we call thyroid profile 5. That's the most complete one. That has the autoantibodies on it and whatever. You can add TSH if you want, but it's a waste of money in the dog. It's okay to use it in the cat. It's important. It basically gives you a 30% discordancy in the dog over the true value. In other words, false positives or false negatives. So
on the TSH.
The TSH. The TSH in the dog is only 70% predictive of primary hypothyroidism. And the reason for that is the dog has a much more active pituitary regulatory pathway to control thyroid function as an alternative to the thyroid. Because remember, we're growing faster, we're living less long, etc. So, and we don't measure growth hormone. So therefore, paying a lot of attention to TSH is really not wise. Okay. So we feel that we shouldn't automatically add that on to a profile because it costs money unless it's specifically needed. In which case we do, if people want it, we have veterinarians insisting because they were used to getting it, having it, and then after, 5 or 6 samples, they say, forget it. It didn't help us at all.
Right.
But in the cat, you need it. It's really indifferent in the cat than the dog. And that's because hyperthyroidism in the cat.
Right.
And the wonderful work of Wakely and her group showing that it's really important to do TSH in the cat.
I have never done a TSH cat in a cat.
It'll help.
I'm going to admit it. I'm going to admit I've never done it. I didn't know how important it was.
Well, you do thyroid profile 4 at Hemopet plus TSH instead of the thyroid autoantibody we do in the dog. It's the same price as thyroid 5. And it's an add-on, and Dr. Peterson, Mark Peterson, of course, being the world's authority, will tell you it's very helpful in the cat, especially if they're over age 5, to detect occult hyperthyroidism when the cat has chronic renal disease and you're not going to see it on a total T4.
That's interesting. Because I over the years, I've had cats where we're like, we know this cat is hyperthyroid. Why is it not showing up? What are we missing? We could not get that T4 to show up high, and the cat has every symptom under the sun.
That's exactly the reason why. So if you do thyroid profile 4, T4, free T4, T3, free T3, looking for the intracellular function rather than the blood function, and then TSH in the cat. In the dog, we do T4, free T4. Remember, the free fraction of T4 and T3 are the biologically active one, and they're only less than 1% of the total. So you measure total T4 with all of the things that can affect it. You're not looking you're looking at the lake and not the guy in the canoe. The T4 is the biologically active fraction, just like the free T3 is the biologically active fraction. And then we do in the dog thyroglobulin autoantibody.
Right.
We can add on other antibodies if the thing looks spurious, but we try not to charge the veterinarian or the client more money unless it's indicated by the initial profile. So if we do the initial profile and we look at the age, we look at the breed, we make our professional comments, and we think another assay is needed, we will tell that clinic, please allow us to add on X or Y, like T3 autoantibody or T4 autoantibody, if it's indicated.
Okay.
Because it affects the results spuriously. If there's a circulating autoantibody in the patient, when you're adding another antibody in the test, it doesn't see it.
Interesting. So you alluded to something that was actually on my list of questions. Are there certain breeds that are predisposed to the autoimmune thyroiditis? Because I can tell you, we we do Cavalier King Charles rescue and English toy rescue, although I've had my share of cockers as well. And I've had cockers with hypothyroidism. The Cavaliers that doesn't seem to be a big problem. I rarely see that in a Cavalier, but there are breeds that I see it quite commonly. Am I just looking for it in certain breeds, or is there really a breed predisposition, and do we have any idea why?
There's a huge predisposition, absolutely. You can look at Michigan State, for example, and look at the list of their top 100 breeds with thyroid disease in their statistics every year. They're a couple of years behind, but you have to. We have the top 20 breeds. They're a little different, but you've got golden retrievers would be right up on the top. Standard poodles, they're such a small gene pool. Now, boxers, ever since Boxer went best in show at the Garden, and we all know how beautiful that dog was, and we know the person who bred him, etc. It's Scottish deerhounds. They're just totally destroyed because of the popular sire effect. So when an animal happens to be a male, is needed for confirmation decisions we make or performance decisions or whatever, everybody wants to have a puppy from that dog. And so they line breed and inbreed intensively on the popular sire effect. And that makes it prevalent. So you can look at the top 20 breeds and Cavaliers are not that common. I agree with you. But you can look at the top 20 breeds, Dobermans, you can just go on and on and
Dobermans.
on. German Shepherd dogs. Labrador Retrievers the most popular breed in the country went from having hardly any thyroid disease 10 years ago to being in the top 10 today. Why? Because they became popular. And look at the Labradoodle and Golden Doodle and Schmoodle and Gamoodle and all of those hybrids. Look at the Bernoodle. $6,000 a puppy, and there's 3 different sizes now.
Yeah.
What are you doing? You're bringing 2 different gene pools, the hybrid vigor part, but also the predisposition to both coming in together.
Yeah. Yeah. No, I think it's kind of a disaster.
Well, pounds and shelters and help, we really should.
Yes.
Being someone who raised sporting dogs and was a delegate for the American Kennel Club, here I am telling you, go to a pound and shelter and don't do what I did. Right?
Well, I've said for many years, when I graduated back in '84, Cocker Spaniels were one of the top AKC breeds. And they got so overbred and pushed out through pet stores. And then they all got nasty. And then I was like, okay, I grew up with a Cocker. I've loved Cockers. I cannot recommend a Cocker, which is how I ended up recommending Cavaliers, because they're like little love sponges. It's rare to find one that has an aggressive bone anywhere in them. But I've said for years, you never want your breed to be number 1 in AKC. You don't want them to win Westminster, because it goes downhill from there.
And remember, this Cocker it started with my own Breesy in 1898 or so. Then the English Cocker and American Cocker separated in the early 40s. And so we still have it in the English Cocker, and it's becoming more prevalent, but it's much more prevalent in the American Cocker. Yeah. And you've got blindness, and you've got bad ear problems, and you've got temperament. And yet we have beautiful Cockers, breeder people that come to see us at Hemopet and screen all their stock, and they're beautiful. I mean, totally breathtaking if you do the right thing.
Yes. I've had clients with just gorgeous, phenomenal. One of them is probably watching, Faith Jones. She had the most gorgeous Cocker in full coat, well-groomed, beautiful. I love seeing that dog. But I think, breeding standards, that's another whole day of lectures. And unfortunately, it's funny, right before we went on air, I was Facebook messaging with a friend who is a top Cavalier breeder and I think she just said the puppies that she showed me pictures of are 4th generation MRI tested for SM and CM. And you just don't see that very often, but that's really what we need if we're going to move these breeds away from these genetic problems that we're just.
Yeah, look at the Basenji until Damer Bolte brought the stock in from Africa. Look what happened to the Basenji. And of course, those dogs were temperamentally not used to North American lifestyle, as you would expect, where they came from.
Right.
And so now you've got a healthier dog that's got a temperament problem. So, I mean, I'm not blaming them. They had to get hybrid vigor in it. And some of them are beautiful and absolutely wonderful and healthy, and they don't have any temperament problems. And some of them are not really good yet.
Yeah.
Adjusted.
Yeah, it's pretty interesting what goes in the breeding world. So do you ever, and this is a question that was emailed in, and it goes along with one of the questions that I had. So this is one of our followers who says, early in my dog's diagnostic life, when she developed the yeasty skin and allergies, she was tested for thyroid and put on thyroid tabs, 0.5 milligram twice a day. I don't know what kind of dog it is. After a while, the vet took her off of it and said her thyroid was now much better and she didn't need them. Is this normal? So the question is, do they get better? I think once their thyroid is trashed, it's trashed, but I'll let you answer that in a sec. She says, is this normal? We still get bouts of alligator skin around her eyes off and on, her elbows always, and the rat tail just the last 2 to 3 inches that went away while she was taking the meds. I knew you were going to shake your head. I don't understand that much about the thyroid to know how this works. Thank you for spending the time with us this weekend. It's much appreciated. So my understanding, if you have autoimmune disease that takes out your thyroid, it doesn't really regenerate.
That's correct. And well, in this case, the first thing is, was it really a thyroid problem? Was it tested properly, or was it euthyroid sick because of the ears and the feet and the skin? So let's assume, for sake of argument, that this dog had the right dose of thyroid hormone, was actually hypothyroid, took it twice a day without food. Okay, so it could be absorbed. And of course it got much better. So do you then stop the therapy? Absolutely not. You retest the dog and you keep it on the appropriate dose. Now, maybe people say, well, my dog took, say, 0.5 milligrams twice a day and it was 70 pounds and it did fantastically for 3 or 4 weeks. And then all of a sudden, everything started coming back again. And when I retested the dog, my veterinarian doubled the dose. I said, whoa, 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 whoa. First of all, you have tissue metabolic debt when you have true hypothyroidism. All the tissues are deficient, right? So the first stuff you put in, even if the dose is too high, is going to saturate the tissue debt. And then you get to the point where the animal's now in the right balance. And so the amount you need for maintenance may be different. It may have been what you actually did, and it's not what the bottle says. The bottle's selling a pill, and they can't change the label without going through all the trials all over again. Right. So we as clinicians have learned that that's not the dose you use. So you don't use 0.1 per 10 pounds milligrams per 10 pounds twice a day. And you don't give it in the meal, in the food, because it won't be absorbed properly. So you give 0.1 per 12 to 15 pounds, depending on if it's a young dog, a small dog, or a large dog. And for giant breed, it's 0.1 per 20 pounds of optimum weight. So the dog is 20 pounds overweight. It's not the metabolism of the overweight, it's the structural needs of that body at the optimum weight to get thyroid hormone to regulate it.
Which is so interesting. I have seen this so often in records that I get for consultations, and frankly, doctors in my clinics and clinics that I've worked in, I did relief work for quite a few years as well. And you just see these doses going higher and higher and higher. And suddenly I've got a 50-pound dog who is on 1 milligram twice a day. And I'm like, what are we doing with these dogs?
Awful. Well, the body's excreting it faster to get rid of it so they don't get overloaded and keel over. We've had animals, greyhounds particularly, because we rescue them, have lower levels, as do sighthounds, normally than other breed types. And so we had a veterinarian north of here that had a greyhound that kept raising the dose of thyroid. This was a 60-pound greyhound on 1.5 milligrams twice a day. And he went berserko. So they tranquilized.
Oh, perfect.
Perfect, right? So of course, then what happens is the client finds out, it was incorrect, and we try to educate the veterinarian kindly, et cetera, and they stop it cold turkey. You can't do that because then you've wiped out. The thyroid is totally inhibited.
Yes.
Yeah, it would be like overdosing steroids and expecting the adrenal gland to work when you stop them cold turkey, right? So you have to decrease it gradually over a week or so, down a quarter, down another quarter, down, et cetera, to the amount. But you see it all the time. You're absolutely right. Yeah. And veterinarians don't know that thyroxine binds to calcium or soy. People that take thyroid hormone know that. They tell them not to take it with their food. And veterinarians say, well, our product on the label says you can give it with meals and it doesn't matter. It's not the species, it's the way the drug behaves. Why? Because probably they didn't want people sticking their fingers down the throat of a dog and getting bitten. Or a cat,
So the thyroid pills are so small, you can hide them in just about anything.
But you can't put it in anything with calcium or soy. You have to think of something.
Right.
If you need something to pill the pet.
Yeah. Interesting. I don't know. They're so small. Mike Cocker, I could have just popped them down. But yeah. I never knew that it had to be given not with a meal until I did a radio interview with you, and you were like, "No, you gotta give it separately." I was like, "Oh, okay."
Really makes a difference, and we've got many studies where people did that and they tested it again. And veterinarians are very happy when you can help teach them what they didn't know about, rather than criticize them. You don't know, whatever.
Right. Well, it's just not something, again, it's not something that we're taught. Yeah. You know, I get mad because veterinarians aren't taught anything about food therapy, but clearly I wasn't, well, I went to school a long time ago. That's part of it.
Well, but we're marketed as students and graduates by big pharma and big pet food industry and whatever. And so what? That's their job, right?
Right.
Have to think about what they're teaching us and decide if it makes sense. Yes. Same thing with our parasite control issues, right?
Oh, Lord. Well, yeah, you and I have worked together quite a while on that one too. That's another problem. So what do you attribute the surge in autoimmune thyroiditis, other than genetics? What else contributes to that?
No question. Environmental pollution, what we've done to the air, the land, and the sea. No question. We've depleted the ozone layer. We don't have enough sunlight to give us enough vitamin D these days. We don't have anything. And we have all of these pollutants that have accumulated. Never mind the fact that everybody, unless they're eating organic, is getting glyphosate, poisoned food, that being Roundup, of course. And you saw that dicamba, one of the alternative weed killers, has just, the moratorium on it has been lifted in the States because the soy breeders, the soy producers, have said, oh, well, they'll go bankrupt if they can't continue to make soy with dicamba until they can figure out an alternative. There's new strains now that have got the parasite control thing inculcated into the gene. So they'll be, whether you agree with genetically modified origin foods or not, I know, I don't either, but they're trying to overcome this. So the government in all throughout the world are being challenged by companies that are going bankrupt in today's economy, saying, please give us a break. Well, how long are you going to give a break when you've known for 10 years this stuff was poison? So it's a dilemma.
Well, I think we'll stop giving them a break for this stuff they'll stop when there's enough lawsuits for the cancers that we can, it just takes a long time to prove that they're connected.
Yeah, there's 15 lawsuits going on right now on that very particular issue.
Yeah, it's kind of a nightmare. So do vaccines play into this autoimmune thyroiditis?
Sure, especially rabies vaccine. Any vaccine can trigger it. Rabies vaccine, and that's the work from Purdue again, can increase thyroglobulin autoantibody production by 25%. Now that's not 25 points, that's 25%. So if the animal's level is upper normal or equivocal, not clear, and it goes up 25%, within 45 days of a rabies vaccine, it could be the rabies vaccine. However, people are in denial, denial being not only a river in Egypt, right? People in denial are saying, oh, well, my dog had a rabies vaccine 90 days ago, so therefore that's the reason why the TGAA is 89 when it should be less than 10. No way, Jose, that's not it. They've got thyroiditis, and of course you want to avoid any vaccine that could trigger it. But again, rabies is by law. If the animal is not well at the time, we have the option as veterinarians to delay the booster or defer it or whatever.
In some states are really, like, we can write exemptions here in New Jersey, but like Virginia, they're nuts. I've got a lot of clients from Virginia, and they're like, well, we're coming to New Jersey so we can at least get a T-free vaccine, but we can't get...
We can do it by law in California.
Yeah, it's nice.
Doctors in Orange County and LA County refuse every single one, even if it's an 18-year-old dog with cancer.
Nice.
That's ridiculous. Prove that it'll kill the dog. Well, you have to give it and then kill the dog, God forbid, right? So we know exactly how this is terrible. Yeah. The Rabies Challenge Fund papers, the study is completed. With Dr. Schultz and Dr. Larson and Chris Christine. And we published the paper in the Canadian Journal of Veterinary Research. And we proved without any question that rabies challenge studies last 5 years with the appropriate vaccines given as puppies. We couldn't do it beyond 5 years. Why? The USDA is the only source of live rabies virus, and they didn't have any.
Okay.
But at least 5, you know, the label is 3, but 5 worked.
Well, sure. I mean, I've done titers. We got this great harebrained idea that we were going to take our little Pookie to Japan for the mitral valve surgery. So I said, well, all right, in order to do that, we're going to have to give this dog a rabies vaccine. And I have not given this dog a rabies vaccine since we adopted her. So it had been, I don't know, 10 years. And I said, well, let me just see what her titer is before I even decide whether this is something we'll pursue, because I really don't. Giving the dog 2 rabies vaccines to get to Japan was more scary to me than having her die of heart disease. And her titer was 14. 0.5 is considered protective. She's 14 and she hadn't had a vaccine for 10 years.
It's only 0.1 in the States. It's 0.5 for international travel.
Right. So this was to get to Japan. So
yes, but a lady with 2 dogs and a cat that gave them all the vaccines over and over, and she never passed. And she finally said, what am I going to do? I said, you can't take your pets to Japan. I mean, come on here. I can't help you. She's already over vaccinated them and they still didn't produce the titers. I'm sorry, you know, leave them with somebody, go to Japan and for as long as you need to be there and come back.
Yeah. There's no way around that. One of my technicians, we both got bitten by a rabid kitten, an emergency service one night at 2 a.m. Frankly, it hadn't even crossed my brain, but I mean, this kitten attacked her and just bit her all over the place. And she looked at me and said, we have to test this thing for rabies. And I went, oh, yeah, I guess you're right. We do. Well, it had rabies. And so we both had to go get the rabies treatment. And she had an anaphylactic reaction on the very first vaccine. You know, I had to go through like 7 of them. And they did a titer at the very end. So with every vaccine that she had to get, she had to go in the hospital on IVs, dexamethasone, and get the vaccine. She didn't develop rabies, thank God. And she had multiple bites. So she didn't develop rabies, but she never developed a titer either.
Oh, boy.
So she left the field. She said, I can't work with animals anymore. This is a little scary.
Yeah, I still have a titer from my vaccine from 1963.
Yeah, me too. I still had a titer from vet school in 84, and this happened probably in 90. But of course, then I had to get revaccinated because I had been exposed. So I'm like, yeah, I think I'm good for life now. All right, let's talk about hyperthyroid animals because I mean, we certainly see lots of hyperthyroid cats, and I'd like to know your thoughts on where that's coming from and what we should be feeding and not feeding them. But the other thing that I've seen in the last couple of years, I've had multiple dogs with thyroid carcinomas with very high thyroid levels. And that's something new. 36 years in practice, and you don't hear anything. Maybe we just weren't diagnosing them. I don't know, but it's very unusual. Unless there's a food problem where you're feeding them too much thyroid gland, you'll get elevated thyroid levels. But so let's talk about hyperthyroidism in cats. What do you think are triggers or causes for that?
Well, we had the whole problem with giving them too much iodine, remember? That whole big to-do. And so then what happened was the companies that sold most of the prescription foods for cats started producing very low iodine foods. Well, that was fine. And then they forgot about the fact that they needed the regular amount of iodine for the cats once they had their hyperthyroidism controlled by having little iodine. So we certainly have that. And then we have all the other issues with the environmental concerns, you know, about hyperthyroidism in cats. And it's becoming earlier. We see them at 6 now. You know, remember it used to be 8 or 10 or 12. Now
I used to not even consider it until they were teenagers.
Correct. Yeah, but now we see it's this environmental. It's the same thing in the dog with hyperthyroidism. But remember, most hyperthyroid dogs with carcinomas do not secrete the hormone. So they can have a thyroid mass palpable in the neck, in the thoracic inlet, or in the chest, and it doesn't necessarily secrete thyroid hormone. So your animal has this mass that needs to come out, or hopefully come out, but it doesn't have significantly elevated levels. The animals we see with huge titers, you know, hyperthyroid carcinoma secreting, It's becoming much more common. Again, it's the environmental effect, the chemical effects in our world. I mean, it's happening to us as well.
Yeah. What are your thoughts? I know that the only approved thyroid medication is the thyroxine, the only one that's veterinary labeled, whatever. Because I remember there was a big hubbub about that.
FDA approved as thyroid tabs, right?
Right. So because I forget, I can't remember the Siloxane was another one that was used for a long time.
Yeah.
Do you feel like we only should be using the thyroid tabs? Is that the one that you recommend?
We recommend thyroid tabs unless people want to use natural supplements like Armor Thyroid or Westroid or Nature Thyroid, but some of them are back ordered now. You can't get them. The other problem is people are underdosing when they do that, because 60 milligrams is 1 grain. That's basically nothing. I mean, so if you have a middle, like a Labrador, for example, you'd have to give 5 grains twice a day. You can't afford that. So we have people that are so holistically minded that they want to do that. So in order to afford it, they give a little bit of thyroid tabs and then they give the other as well. So they do some of each. Remembering that the natural, quotes, glandular thyroids have T3 in them as well. And if you try to raise the T4 up, you're adding more T3, which goes directly into the cell and could harm the heart, for example, if you had some kind of cardiac, significant cardiac disease. So to try to raise up the T4, you give more of the natural glandular, which gives you too much T3. And what does that do? It downregulates the T4. So it's a complete diagnostic mess. You have to have people like me that deal with all these weird combinations all the time to try to sort out what they should do. And when a cat that has hyperthyroidism has been treated with methimazole or I-131 or whatever, 2 to 5 months after their thyroid gland has been wiped out, suppressed, they become hypothyroid. And that's a huge controversy. And Dr. Peterson and I basically have been trying to teach people about that. They do become hypothyroid. And if you want to then stabilize the cat to make their thyroid normal, but not too high, you have to give them some T4 and some T3, a little bit of each.
Which is interesting because the whole reason that people go through the I-131 is so that they don't have to medicate their cats.
Right, but you can't. I mean, in 2 to 5 months they'll be, and we have some feline-only practitioners that are excellent. And there's a hyperthyroidism treatment, social media group. I don't know what it's called, and they all are told to contact us about what combination of therapy they need, because the cats start to become hair sticky uppy, not social, not interacting with the household at all, not eating well. Instead of the ravenous appetite they had before. Right. And so they become not acceptable as a pet in a family that are devastated. They don't know what happened. And so as soon as we tweak the thyroid properly with a little T4 and an even littler T3, they're perfect. They become a cat again.
Where do we get T3?
It's Cytabin. It's called.
Okay. I remember that. I haven't used it in years, but I do remember that.
It's called Cytomel, the human product. And the dose is not the way it is in humans. It's a microgram per pound twice a day, even though you're supposed to give it 3 times a day because it has a shorter half-life than T4, 6 to 8 hours. But it's too complicated for people to give the T4 product twice a day and the T3 product 3 times a day. Yes. So we modify it by a microgram per pound twice a day, along with whatever the dose of T4 would be, a low dose to stabilize the cat. And we've got lots of data.
So here's my takeaway for all of you that are listening to this. Thyroid disease is complicated. So remember my first question, is this simple or is this complicated? And if you're like me, your head is spinning and you're going, oh my God, I thought I had maybe half a handle on this. Now I realize I didn't even have my pinky finger in the teacup handle. So what you need to do is you need to download this video and send it to your veterinarian and say, you might need to get educated on thyroid disease because it's not simple. And the other thing that I would recommend after having this conversation, and I've had this conversation with Jean a couple years ago on my podcast, I would recommend that when you if you have an animal that has thyroid problems, and I do have quite a few of, because of doing holistic and integrated medicine, I have quite a few clients who are those metal personalities who have to have everything spelled out exactly in their little spreadsheets. Those are the people who come to me and say, I want my blood sent to Dr. Jean Dodds for the thyroid because I know that she knows what I need to be doing. And I did see, and one of the things that you need to do when you send the blood there, there's a little box that you can check off that says, I would like an interpretation of this test. Always check that box. Otherwise, it comes back and your veterinarian's like, well, I don't know what all that means. Check the little box. But I did see it's
you get it automatically.
There you go. Did I see something come through the other day that Dr. Gary Richter is helping you out?
Gary Richter and Andy Zuckerman have been helping me ever since we met years ago at the AHVMA conference. I put an ad up because I was doing so much work, I couldn't do it, anymore. So they're trained, both Gary and Andy are regular consultants to us. And sometimes they ask me my opinion, and sometimes clients want my opinion in addition to theirs, but we're all basically on the same page.
Yeah.
They get it.
Yeah, that's what I thought. I saw a report came in and it was Dr. Gary Richter on there. And I said, huh.
He's been a friend for years.
Yeah, well, he's awesome as well. The holistic veterinary community is not that huge. I wish it was bigger. I wish there were more of us, but we, let's see. Oh, Theresa Carpenter is laughing at me. So Theresa Carpenter is one of my followers. She says, Judy's raging again on the metal personalities. So Theresa's a good friend, a Cavalier owner, and she's the one who had a dog with a thyroid adenocarcinoma that produced screeching high levels of T4. And if I remember correctly, that dog, we did a lot of Chinese herbals, acupuncture, all kinds of things. And the dog had mitral valve disease, so couldn't have surgery to get rid of this thing. And frankly, it took them years, I think, to figure out what it actually was. I think they thought at the beginning it was a heart-based mass because that's where it was sitting. So if I remember correctly, he actually got put on methimazole because they didn't know what else to do to control.
I could do that. Absolutely. Why not?
So, yeah. And I'm not sure if his final demise was from his heart or from his tumor or just the combination of the two causing. I do remember he was on oxygen at the end, so it may have been more heart. But yeah, interesting cases that when you do holistic medicine, you get people bringing you the things that nobody else can figure out. And, some days my brain hurts. Like I can't figure this out. But thankfully, we have people like you who are, I see a lot of my people that are commenting on here are people that they're the ones that have asked me to send labs to your lab. We just know that if you have thyroid questions, Jean is the person to go to. And when I first started in practice, so we're going back to the 80s, we use University of Tennessee for all of our adrenal stuff. We use Texas A&M for all of our GI stuff. And we used to use Michigan State for all of our thyroid stuff. It seems like each university is known kind of for their own thing. Does Michigan State use the canine reagents and the feline reagents? Are they more aligned with what you're doing?
The only thing they haven't done, and you have to pay extra for that, is they don't do age and breed specific ranges automatically. Okay. I don't know if it's because they don't have the database that we have. We have a 20-year database, so we know that. But they're fine, and many people use Michigan State because their veterinarians are used to it, for example. Right. And then they send us a profile to help with what to do next.
Right.
And that's fine. Okay. I'm happy to do that.
Yeah, it's interesting. It makes me kind of look at all the testing that we do. Be nice if the labs would. Well, they're never going to tell us. Why did the big vet labs not use canine and feline reagents?
Well, they get contracts, right? With huge. No, you're talking about gazillion-dollar contracts, right? To do a particular reagent, and it's got nothing to do with the consultants that are working for the company. It has to do with the people that are marketing what their cost share is and whatever. you know, I mean, that's not surprising, is it?
No, it's not surprising, but it's like, well, you're testing a dog, so you should use a dog reagent. You're testing a cat, you should use a cat reagent. You're not testing a person.
Yeah, I know, but whatever.
Yeah, whatever.
If we want funding to study animals as models for human disease, we argue the opposite.
Yeah.
Whatever.
Whatever.
Can you imagine, like, coming from the Northeast to California and trying to tell the people in California that they didn't learn things properly about thyroid?
Yeah, how'd that go?
It was a difficult row to hoe.
I would imagine. You know what, Jean, you're a strong person, and you are so knowledgeable that I can't imagine if someone sat down and talked to you for 10 minutes, they would go, oh, geez, she knows what she's talking about. Okay, we'll back down. So I think you're safe. We're out of time, but Jean, thank you so much. I literally could talk to you. We could probably talk about this for a whole week. And then, all our little tangents that we would go off on, they're like a year. But thank you so much for agreeing to come on and do this. I think that everyone who watches this is we're sending them out the email so they can download it. I think it'll be sent to a lot of veterinarians. Maybe we'll educate them, but I think it'll really help pet owners they probably have no more clarity, but at least if they pick out little bits and pieces, they'll at least know what to ask for.
Judy, all these veterinarians need to be told by their trusted clients, please, doctor, just try. And once they do it, they're in the camp, no question. They immediately.
Yep. That's what we hope for. So, all right, everyone, thank you for joining us for this long weekend. I'm exhausted. I don't know about the rest of you. I think I'm going to have a celebratory martini because this was awesome. And for those of you who watch me weekday mornings around 8 a.m., I think we'll be on tomorrow about that time because I got a big meeting for later morning. But we'll be on and we'll kind of rehash our weekend. And I'd love to hear your feedback and your thoughts. And we'll do this again sometime soon. Thank you very much, Jean.
Thank you, Judy. Love to everybody.
Bye-bye.